Well, welcome back, Dr. Vishal. It has been
Namaste.
so awesome, the feedback that we're getting from our podcast. And I'm still getting people messaging me saying, "Oh, just watched your episode number 2." And someone else I spoke to said, "I keep checking notifications to see when your next episode's coming." So it's such a delight to be able to catch up with you today and have another conversation. And
Thank you.
what what we're liking about our podcast is that we have this thread winding through that kind of connects one to the other. So today I thought we would start off with talking about choices of healing and the fact that it actually is our choice as the individual of how we heal and what happens on that journey. And what are your thoughts on that?
Thanks, Julie. I think it's been wonderful 2 episodes discussing with you on various dimensions on what we call as moving from fighting to healing.
Mm,
Now, I think if you look at the first 2 episodes, the first one we spoke about healing versus fighting, and in the second one we spoke about the statistical outliers and insourcing our cancer healing. I think so. We've been continuing this thread, and between us, the resonance has been very strong in terms of the synchronicity of our thoughts towards the fundamental aspects of healing.
yeah.
And I think so. Today, I think between us, something that I wanted to share with you was patient perspectives in this path of healing and in this path of curing have been very diverse. They have been divergent.
Mm,
And when I look at 2 decades of these experiences of patients put together in a nutshell, and when you see them as a spectrum, the one thing that very clearly stands out is that there are various pathways to healing, and there are choices in healing.
yes.
And this aspect of insourcing of our cancer is something that we need to dwell with. And that's where we need to look at, I would say, the instinct, the intuition, and the intellect coming together, trying to tell us what is best for me,
Yeah.
what is needed for me, and a proper coach, a cancer coach guiding you into helping you delve into yourself
Yeah.
and scientifically handholding you through the science of healing. I think this is where the clinician, the cancer coach, the patient, all three come together.
Hmm.
And I know in many, I would say, economically less affluent countries, it may be difficult to find a cancer coach or
Yeah.
sometimes a psychologist or a rehabilitation team. But I'm glad and happy to tell you that today we have good online platforms by which we could actually assist patients through giving them the support of a cancer coach, where a clinician, the cancer coach, and the patient come together to actually open up this conversation on the choices of healing. So I would want to put this across to you, Julie, to ask you, would you think that this would be the ideal approach for us to talk about that when we are encountered with a cancer, we talk about a standard modality which is following some guidelines, which is based on a combination of surgery, chemo, radiotherapy, immunotherapy in various aspects, either single modality or multimodality, and parallelly create a separate chart for the patient, which gives him a list of informed choices
Mm,
about his choices in healing, and how does he take this journey towards an inward healing to fundamentally address some of the questions that have been, I would say, an impediment in the progress towards his healing journey. I think that is something we need to come to as a joint discussion today.
yeah, absolutely. And from someone who has sat in a doctor's surgery and they've said to you, Actually, this is how my doctor said I had cancer. He said, I hadn't even sat in the chair, and he said, oh, well, just as I suspected, you've got the old Rudolph and Prancer. And I said, excuse me? He said, yep, just as I thought, you had cancer. And I went, oh, I actually wasn't expecting that. And it kind of set me back a little bit. And I thought, okay, what do I need to do? Like, I can go and have surgery and I can have that cancer cut out. But what else do I have to do to actually live through this? And the other thing he said to me was, yours was the most positive cancer biopsy that I'd received the test results of. And I thought, okay, well, that's not very grand, is it? And the thing that I got given, as because I went inwards and I went, okay, God, I don't want to die. What do I have to do? That was my very first question. What do I have to do to live? The answer I got was meditate for an hour in the morning and an hour at night. I didn't know that at the time, that meditation actually returns the body to homeostasis, which is the relaxation response, which is how the body heals. And so I just followed that instruction and I meditated for an hour in the morning and an hour at night. And what that did for me is it made me really strong and resilient in my inner world. And I worked for Busy Barristers at that time, and I was in the lift, and one of the barristers said to me, Julie, how come you're so happy when you have cancer? And I said, no, I've had surgery, the cancer is gone, and I meditate, so I'm happy. And he was so shocked with my answer that he didn't say anything more to me. And I had to think about that people are not expecting, people that are like the general population are not expecting people diagnosed with cancer to actually be happy. And I think that that's one of the things we have to make a decision that we're going to be happy on our journey, and that our thoughts impact our cells, our thoughts impact the water within us. And if you've looked at Masaru Emoto's science and research, it's that water can be changed by our thoughts and our prayers. And so I was very into Masaru Emoto at the time, and I thought, if people can put their hands together and send a prayer into some murky water and change the crystalline structure of that water, then I can change the crystalline structure within my being. And that became my purpose in my recovery. And I think I did that really well. But one of the things that happened to me, Vishal, is I went to see the cancer specialist in the hospital, and he was in charge of my overall recovery. And he put his hand on my leg and he said, and how are your family doing? I said, oh, they're fine. I said, why do you ask? He said, well, my dear, you do have cancer. And I said, no, I don't. I had surgery and the cancer's gone and I'm well. He said, oh, no, that's actually not true. And it completely unraveled me. And I know that he was doing his job, but where I had my inner world, it took a bit of a beating. And I thought, am I imagining this? Am I kidding myself? Am I not well? Am I sick? And he was telling me that because he wanted me to do the radioactive iodine treatment so that any rogue cells that were left in my body could be dealt with. I thought about all of that and I agreed to the treatment. But I went home and I meditated that night and I went, you know what? This is my journey and this is the journey that I'm going to run. And so I was able to get myself back into my positive. When I say positive, it was in this belief that I was well, that I was recovering, that I was going to make it through. And what happened when I spoke with him is I experienced doubt. And it's the doubt that is the thing that messes with your mind. And so I was able to actually quieten the doubt and get back into my relaxation response state and keep healing. And that, I think, is really important. It's your inner world. No one out there can actually inform you how to do your inner world. That's a decision that you have to make, and it is a decision. And it's one of the choices that we make in healing.
Absolutely. So I was remembering something very interesting as you spoke about. So let's start with some of the less controversial topics in healing. And then we move towards the more controversial ones. But I'm really interested to touch every single topic on healing and the debates around it, because I think it's finally science that has to succeed, along with logic, ethics put together that should eventually give us the goal of healing and opening up the path towards a life which we have with or without cancer. Like I said, in harmony with it. So, Julie, I was recollected of a very beautiful anecdote that I had heard as you were speaking of three Zen masters who were walking in the forest. And the senior most master, when he came across a stream of water, sat down in a meditative posture, meditated for a few minutes, stood up and walked across water on that stream. Very beautifully watching this, the second disciple, the second disciple who was the senior one, also following the master, meditated this time for a few more minutes, got up in great poise and walked across water. Now the third and the youngest, the junior most disciple, hesitant, took a little longer, meditated a little bit longer, and while he opened his eyes, he was hesitant, and when he put his first leg into water, slipped and fell into the water and started to drown. The other two masters on the other side of the stream looked at each other and smiled and said, "I think we need to tell him where the stones are." So I think the beauty I often see of meditation, and when people talk about meditation, I think the most important thing that meditation does to you is not magic, but gives you clarity of thought to yourself. And I think that's where I would like to encourage people to say, I don't know, there are maybe 1,000 techniques in meditation. Every group has its own way of positioning meditation as a unique intellectual property of their own. Two, there are various community groups that help in meditation. I think the single most important denominator that I have deciphered out of meditation is it gives you clarity of thought. It helps you go inwards. And that's what we've been talking about, of insourcing our cancer healing. And meditation is a wonderful, wonderful step. And there are maybe several pathways in meditation, but I think the simplest of all is to looking inwards. And I think I from various meditative techniques that I personally tried, experienced, listened to spiritual masters, I've made some of my own inferences, I would say, not conclusions, but inferences.
Mm.
Because what I found through these experiences of meditation was that when you are in meditation, you are trying to cut off your mind. I feel we are three people. We are people whom we think we are,
Mhm.
which is our mind and body. People whom others think that we are, our name, our identities, and people whom we really are, which is the universal soul. Now, when you look at the soul aspect of it, you have to cut off your mind in order to experience that meditative openness, that flow of journey where the universal consciousness connects with you.
Yes.
You call it in whatever form, religion, caste, creed, religion, color, but I think that flow of energy is pure and absolutely undivided.
Yes.
And what I experienced in this is that when you do this meditation, and I would want to hear more from you, that for me as a cancer caregiver, as an oncologist myself also, I need to go through certain catharsis, because if I need to give positivity to patients, emanate positivity, I also need to work on my daily churn of what I go through and how much I face, while
Yeah.
every intent of mine has been to try and look at how do I help a person heal better.
Mm.
The the important thing was that in meditation techniques that I found was the aspect of breath, which was most important.
Mhm.
And in this, the simplest of all, what I learned was between your complete breath when you intake it
Mhm.
and between your complete breath when you give it out and exhale it, comes a point when neither inhalation exists nor exhalation exists.
Yeah.
And that's the point which, for a fraction of a few seconds, you may experience the state of what we call no mind or mindfulness,
Mm.
which I think is a very, very simple technique to reconnect.
Yeah.
Because it's at that point that everything dissolves, your identity doesn't exist anymore, you don't exist anymore. And that's when you need to really get the fountainhead of energy form
Mm.
for your consciousness.
Mhm.
And through this entire aspect of the choices in healing, I believe meditation is one of the most simplest and yet one of the globally most least utilized tool in the war on cancer. In this, unfortunately, I'm calling it war again, but I'm just saying that in this entire journey, I think the power of meditation has been grossly underutilized, and something that people can, with whichever guru, with whichever faith, with whichever technique, work towards simple aspects of the science of meditation, which is what I was talking about, those Zen masters.
Yes.
I'm recollected of a very nice conversation which I watched in the movie of Patch Adams, where Hunter Adams is talking to Arthur Mendelsohn. And there's a very nice, intriguing question. The scientist Arthur Mendelsohn asks every patient who walks into the mental asylum. He shows something like this and asks them, "What's this number?" And they all give him the number 4, and he says, "Wrong answer." I'm vaguely recollecting that movie scene, but Arthur Mendelsohn walks into his office at night, into his room at night, Arthur Mendelsohn's room, and asks him, "Can you give me an answer to this particular question?"
Mhm.
And Arthur Mendelsohn, busy in his work, just ignores Hunter Adam and says, "Look, I have better work to do." But this man's coffee mug, the plastic, the paper cup mug is leaking. So Adam takes it and puts a tape and fixes it.
Mm.
So Arthur calls him Patch Adams, because he
Yes.
patches that small cup. And then he gives him a very beautiful answer. He tells him, "Look, since you've patched my problem, I'm going to give you the answer." He says, "Look, again, look at this and tell me how much is this." And he says, "It's like 4." He says, "Now," he says, "go far away." And as he goes far away, he says in that distance, as he goes far away, he sees the fingers starting to blur.
Mhm.
And he says, "Now it looks more. It looks like possibly 8 or something." I think the simple lesson he tells him is the closer you get to the problem, the lesser are the solutions. The further away you go from the problem, the larger solutions that you see. And I think choices in healing today in cancer for me, from the way I look at from Patch Adams' way, is not to get too close to it. Because,
Mm,
like what you rightly said, Julie, you get too close to the problem and somebody says, yes, you know what, it's relapsing, you're recurring, you're not having time, you're getting too close to it, and you cannot make the actual decisions in the choices of healing.
yeah,
So you need to go back again, and that's what you did. You just went back into cutting yourself off from that information to again going inwards
I did.
and talking to yourself.
Yes,
And I think that's a beautiful learning which you have shared with us today. I perfectly believe in it, and the two stories that I've been telling are resonating with. One is I think you need to have a bird's eye view, a 30,000 feet
yeah,
height kind of view of where you are with
yeah.
your body and with your oncologist and your family. And
Mm,
the other one is meditation as giving you a clarity of thought to connect with yourself and with the cancer cells, with your oncologists, and the rest of the ecosystem of caregivers around you.
yeah, absolutely. And you know, I'm I'm reminded of one of our conversations where you said we're not fighting the cancer cells, we're actually coexisting with them. And I've always thought of cancer cells as rogue cells, not as cells that I have to kill or that I have to get rid of, but heal. And there's a different energy, there's a different frequency that comes from your heart and your mind when you think about cells that are just not quite right. And so, what I've learned in the work that I do is when you love something, when you give it that pure energy that you were talking about before, in the state where your immune system can do its job that you were born to do as that baby, then that energy, it's light. Like there's light in our cells, and scientists have proven that. And so if we can make the framework of us, the electricity or the alchemy of us be love and be light and be connected to the source, the field that we're in, that's when the transformation can happen easily, not where we're caught between a rock and a hard place, and we have space. And when we are caught between a rock and a hard place, that's when we feel like we have no choice. That
Sure,
my whole goal when I work with my clients is to extend that space so that we've got more space, so we've got more option, more choices, more opportunity to see the bigger picture. And when you're like this for 10 out of 10 of stress or worry, concern, whatever it is, and you then get that space, you can breathe better. When we breathe better, we get more oxygen. So that's a physical thing that is happening. When we breathe better, we get more oxygen. Our body can do more with more oxygen. But we also have that freedom to look at more options and to look at more choices and to feel more free. And when
sure,
we feel more free, we feel lighter, we feel brighter, we feel more capable of doing the inner journey.
sure.
Does that make
And I
sense?
think absolutely, Julie. I just wanted to add one point to this entire conversation of what you brought out, which is the axis of consciousness and love.
Mm,
And I think there are four things for me that pertinently matter in the choices of healing, which I think are some of the most relevant ones when we talk about it. So I think the first step somewhere is I talk to my patients and I tell them that, look, you are at an interesting fork in your life when you have to make a choice between your ambition and your purpose in a
Mm.
simple way.
Yeah.
We all want to live, we all want to have our material world, we all want to make money, we all also want to grow in our careers, stabilize our family lives. This is common to all of us.
Yeah.
Sometimes cancer comes as a knock in your door to come and ask you a very fundamental question on what is it that you want this extra time for.
Yeah.
And I think it must have done it to you, it's
Yeah.
done it to millions of people. And that's a beautiful awakening point when you need to again insource into yourself and ask,
Mm.
what is the purpose of my life that I want to do, and for which I'm going to go through all of this healing to again somewhere give back to the world something more than what I have received. And I think we as humans are unique in that species that we only receive more than we give.
Mm.
And cancer somewhere comes as a wake up call to tell us what is it that you can add into your life. And I don't think it says don't have ambition, it just says add some purpose to your life, with which it need not be grand, it need not be great, it could be something very simple, subtle, but I think it comes with that particular thing. And the day you accept it, to say that I think it has come to ask me that the next few years, in addition to all what I'm going to achieve and grow, and how will I give it to the world, and what would the world benefit from it? And I think that's a clarion call that this particular C word calls for many a times, which we ignore in our calling.
Mm-hmm.
And the three aspects of the patient triangle that I believe that make the most important choices in healing for me, and I would request you, Julie, after this to add into this.
Yeah.
I call this triangle as centered by the patient's consciousness, but divided into three parts of the triangle by the diet and nutrition, the water, and the oxygen. I think if you simplify it into these three, you have a whole lot of important understanding about cancer. I often tell to my patients, look, diet is not the same as nutrition. Your
Mm.
diet is for your food, for your palate, for your enjoyment, for what you eat as calories. Nutrition is what the cancer cells look for in terms of the immune system getting activated. And today there is enough of evidence and no debate on saying that food itself is medicine. And if our patients start to look at studying and working on food itself as much as they would give importance to chemo, radiotherapy, or surgery, you would see the acceleration in the healing process.
Yeah.
Now, I think this is a separate topic for a detailed discussion, but I would want to just summarize it by saying that a good nutritionalist handholding you and understanding the balance of sugars, fats, fibers, vitamins, minerals is, is absolutely the bedrock of healing for the body's immune system to awaken. And we know today from 1929, when Otto Warburg proved that sugar feeds cancer in his Nobel Prize work on Warburg effect, that cancer cells do not live on proteins, vitamins, minerals, fibers. They only want sugar. PET
Right.
scan is a proof that you inject sugar and the tumor glows up.
Yeah.
So we know how hungry these tumors are to grow, and that's the time we don't feed it more with sugar rush.
Mm-hmm.
The second, I believe, is simple intake of plenty of fluids, water, provided you have no other contraindication. Water is the most important element that our body and this earth is made up of, and is the greatest detoxifying agent through all our therapies.
Yeah.
And the
Wow.
last, which is the combination, I say, of meditation and yoga or breathing exercises.
Mm.
Because we know today that in the presence of oxygen, the cancer cells cannot grow.
Yeah.
Most of the times, Julie, I see patients who are shallow breathers. That
Mm-hmm.
means in 1 minute, we are supposed to take 12 breaths. I see patients who hardly take the 12 breaths with a complete breath.
Yeah.
I'm saying one good deep breath where your gas exchange takes place in the base of your lung, at the base of your lung, not here. But most of us are shallow breathers who don't even take a good deep breath. So simply oxygenating your cells could be the biggest boost you could give to your immune system every minute. So
Yes,
let's say you can't do it 12 times in that 1 minute, do it once in 1 minute. That's the greatest gift you could give to yourself, and you'd add meditation into your day to day life, minute to minute, without going through a complex course where you have to sit for 1 hour in a corner isolated. You'll always realize that you're automatically getting in sync with the universe.
that's it. And
Yeah, so
I actually want to say something here on that. If you went to the gym and you did 1 hour of weights and equipment once a week, you would not get very much result. But if you went to the gym for what's 60 divided by 7, so 9 minutes, 8 to 9 minutes every day, you would get results because you've got that consistency every day. And as you just said that about do the breath, like deep breathing for 1 minute out of every hour that you're awake. So let's say you're awake for 15 hours. That's 15 deep breaths that you're doing every day. That's more oxygen than you have probably ever had in your body consistently. And that's my new commitment to myself, to do deep breathing every hour of my waking day.
and Julie, I keep telling this to my patients that look, in every minute we take 12 breaths.
Yeah.
Imagine if in that 1 minute you would take one more deep breath,
Yeah. So
how much you could make. And that's the fundamental principles of yoga. That's the fundamental principles of meditation, where you reconnect with yourself, where you re-energize yourself. I mean, there are thousands of theories around the magic of yoga, meditation, prayer. What do all of them do finally? So I think it all culminates into this aspect of how do these cells start to communicate with each other. Interestingly, in our immune cells, they talk to each other through these special cells called cytokines, which actually talk to each other. So our immune system, which is leukocytes, talk to each other with cytokines. And we've realized today, with good amount of proof through so many publications, paper, that simple aspects of meditation, yoga, breathing exercises, good amount of nutrition, balanced nutrition, and looking at water intake could actually make a beautiful combination of a healing formula to start with in your choices of healing.
yes.
So I call these the basic triangle or the basic pyramid of healing mantras that one should know when you embark on this healing journey, because that's when you start seeing the milestones more clear.
Yes.
You start seeing who's the one who's navigating you more clearer, your decision making power in each of this healing journey, and I call these the informed decisions. You're able to make better informed decisions for yourself and for your caregivers,
Yeah.
and that way you become a much more inclusive part of the healing journey, in which you realize all of the people, including your physician, becomes a part of this ecosystem and healing. I'm fondly recollecting a sage who had come to me, a Himalayan master, who once sat with me, and while we were having this conversation, told me something very beautiful. He said, Vishal, he said, whenever possible, try to touch people. He said, spend your time touching people. And I really strongly believe in the power of the healing hands.
Yes.
He said, let me give you a science behind it. And he gave me something very logical. He said, look, there are hundreds of people waiting outside your room to meet you, to take your consultation every day. And think of this, and how many of them pray for you. And it's a testimonial for me in that I know how many of them who come to me, sit down to me and tell me, doctor, today my family sat together and prayed for you.
Oh.
Now imagine the amount of healing energies that they are transferring to you through blessings. So he asked me a simple question: what do you do with all of these dividends? He says, use them to give it to others, because you cannot buy a Ferrari with this. He said,
Yeah.
you cannot do anything with this. But what you could do with this was give this to others, pay it forward. So he says, remember this. And from that day onwards, I think I take this one single suggestion he given me very, very close to my heart and seriously, that even if a patient is terminally ill, dying, if a person is not recovering in, patient is in coma, go close to him, hold him,
Hmm.
and if possible conversate. I encourage my patients and their family also to say this to them, that whenever even if the patient is in the intensive care, get close to him, spend time, if it allows, with infection protocols and others, hold his hand, talk to him,
Mm.
and conversate with him. Do not think that he is not able to hear through the cognitive limited senses.
Yep.
There is another sense that prevails beyond all of this and connects you. So do that, and you'll realize that there may be better decisions that you could do with your patient's family and with yourself, put together as a team. And that's what this entire journey could be more meaningful about, as we are talking about this together.
I'm actually reminded of when I had my clinic and I had people coming and seeing me. A woman brought her husband, and he was in the final stages of cancer, and I think she thought that I could cure him. And I said to the wife, look, I really need to talk to your husband on his own. And when she left the room, I said to him, I can't cure you. I said, but what is it that you would like? What made you come here today? He said, well, I came to make my wife happy. I said, okay, that's awesome. But how can I help you right now? He said, if you could just put your hands on me. He said, because since I've been diagnosed with cancer, no one will touch me. I said, I can do that. And so I just put my hands on him for 45 minutes, and we didn't speak. I just put my hands on him, and he said, you have no idea the gift that you have given me. It's making me actually teary. He said, I have missed that. And so I guess what I would like to say to people who are the loved ones of someone who has been diagnosed with cancer, don't stop touching them. Like, touch is so important because it's moving the energy, and it makes you feel connected to source as well. When there's another human that is touching you, there's an electricity, there's a connection that happens. And so just remembering that, I haven't thought of that memory for 20 years, and you just reminded me of it. It just
Thank
flashed
you.
in, and I thought
It's such a beautiful.
important.
Thank you, Julie. That's such a beautiful example. That's such a simple, I think you couldn't have simplified it better than that. That the therapy that you gave was just sitting and being with somebody, being just a good listener, touching them
Mm,
itself transfers pure, unconditional love to a person, to convey to them that you care.
mm,
And I think that's such an important evolution in our treatment patterns in cancer.
yeah.
And I keep reiterating this, that the power of the healing touch. And today, as we move more towards the hand to mouse syndrome, where we touch the mouse, we click the buttons, we know the reports, we know the scans, but we forget to touch them, hold them, and tell them that we care. And I think it matters so much to simply convey to some of these patients in our learnings.
Mm, yeah. I think that touch is incredibly important, and for people that are listening to us who have cancer, don't be afraid to touch, to
Uh,
ask for someone to touch you.
I want to add one point here, Julie. Again, something which I learned from this monk, but I think something very beautiful. See, every time a patient came to me, and sometimes, in the Indian tradition, they would either hug you or sometimes they would touch your feet to take your blessings as a physician, as a healer.
Mm.
They would they would say thank you to me, and they would say that you have come as God in our lives.
Yes.
And I would reply saying that you have come as God in my life.
Yeah.
You see, I tell them that there is nothing called higher and lower in God.
Mm.
Do not put me at a higher pedestal and put me in God, because for me, what I've simply learned from that monk's conversation with me was very, very thought provoking, was that look, you do not have to go to a temple, church, a mosque, or a synagogue.
That's it.
You do not have to put up some costly prayers or do some ceremonies. Just talking nicely to your patient is a prayer.
Yeah.
Touching him and trying to heal him is by itself a ceremonial offering to God.
Yeah.
And do these two right, and don't visit a temple, church, or a synagogue. God will try to visit you sometime when He's free. And that beautiful thing, what He said, resonates so much with me today, that I keep telling people that look, as cancer patients, you've come to me as God. And it's my great opportunity to be of some use and service to you.
Mm.
I have not seen him anywhere else other than in you.
Yeah.
And you are sitting in front of me. So this is all that is there. This is it. This is God here. And so I think putting all our thoughts together on healing, and
Mm.
not to use the word fighting, to look at it from a IQ, EQ, and SQ level. You have to somewhere integrate this aspect to open up the choices of healing to the patients. And I think that's the whole mantra we both are coming out to allude to in our choices in healing.
Yes. Yeah. Absolutely. And I think that we might wrap that up for this episode, Vishal, and continue into our next episode, where we might talk about some of the different choices of healing that um, people are making. Like, lots of different choices are available. And I think it would be good if we could expand on that. And look, one of the things that has like really, really moved me in my work that I've been able to, I've been incredibly privileged to be with people in the last stages of life as well, and help them through the death process. So I think that that might be something that we can talk about in an
Sure.
upcoming episode as well. It's and I'm going to wrap today up with this message that for me, to be invited into the last stages of someone's life is as much a privilege and an honor and such a sacred moment that I liken it to the birth of my children, and the awe and wonder and the sacredness of bringing a life into this world. There is a sacredness, an awe and wonder into being available to assist someone to transition into the afterworld, whatever that is. We won't know until our time comes, but it's an absolute honor. And I think that that's something that we probably will have a good conversation about as well. So I
Sure.
think
Thank you.
that we've covered off on a lot today, and thank you for joining me.
Thank you. Thank you. Namaste.
Namaste.